Hello everybody, welcome to another presentation of the kind of life-changing dentistry that my team and I at London Dental Specialists carry out on a routine basis. If you like this video, please subscribe to our YouTube channel or follow London Dental Specialists on Instagram and Facebook. So let's get into today's presentation. So this study's 8-year-old male was referred to me by his hygienist, and the hygienist's main concern was the amount of bone loss due to gum disease that had happened on this particular tooth. This particular tooth is the upper left first molar. So let's look at it in a bit more detail. The blue line that you can see here represents the position of the bone when that tooth first came out. And the red line that you can see represents the severe bone loss that has happened. And it is so severe that the shaded area here in yellow shows the sinus. So that ultimately means that the bone loss on this tooth is very close to the sinus. You can see that there's very little gap between this red line and the sinus, and it's therefore not surprising that the hygienist was concerned. Fortunately, in this situation, the tooth wasn't loose, and the hygienist spotted it early enough and sent the patient to me. So the options for these kinds of cases where there's been severe bone loss is either extract the tooth and replace it with a dental implant, or gum surgery to save the tooth. And here at London Dental Specialists, we exist to save teeth, and so that if it is humanly possible to save your tooth, we absolutely will always choose to do that. So let me show you exactly what we did. We initially got my excellent, absolutely amazing root canal specialist, Dr. Neha Patel, to do a beautiful root canal treatment on this tooth. And this is what these white lines are, absolutely stunning root canal treatment. And I then did some gum surgery on this tooth. So to start with, the tooth had approximately 9 to 11 millimeter pockets. And you can see here that there is a hole in the gum. There's a severe amount of gum recession. And I have also removed the root of the tooth that was here. This will work as well as a dental implant, and that's why we chose it. The other reason why I have put this picture here is that to keep this tooth in the long term, there are two main things that we need to think about. One is the patient's ability to insert a green or an appropriate interdental brush, in this case the green interdental brush, into the gap between the roots. And the moment they can do that, it massively increases the long-term outlook for this tooth. And the other thing that this patient needs to be aware of is he needs to be really careful about his diet. As long as he can restrict sugar to mealtimes and mealtimes alone, and perhaps use a high fluoride toothpaste, as is this case, then the long-term outlook for this tooth is as good as a dental implant. So let's compare both of them. The treatment of this particular tooth took about a month. If we were going to replace with a dental implant, it would have taken 8 months. It cost this patient approximately £2,500. If we were going to replace with a dental implant, it would have been about £4,000. And we also have what we call the endo implant warranty. In real terms, what it means is that if we choose to save a tooth, either with root canal treatment or with gum surgery or a combination of both here at London Dental Specialists, it's impossible to absolutely guarantee that it's going to work in the long term, and nothing is guaranteed in healthcare. But we believe in sharing the risk with you. So if we choose to advise you to have this kind of treatment, and in the highly unlikely event that it fails within 12 months, the money that you've paid towards saving that tooth will be put to a dental implant. And you would know that from the start, okay? So that you would know the cost of saving the tooth and the cost of the dental implant, so that no one is out of pocket. We really, really believe in what we do. We really, really believe in saving teeth. So why not either speak to your hygienist or refer yourself to see me, and my team and I are here, open and willing to look after you. Many thanks.